If you're feeling bloated, heavy in your lower abdomen, or just not like yourself, it is very easy to blame stress, hormones, acidity, or age. But sometimes these vague symptoms are your body's way of asking us to look for something deeper. Today, I want to talk about ovarian cancer or fallopian tubal cancer, which is rare, yes, but serious enough such that every woman should know what are the warning signs without any fear. Hello, my name is Mr. Saurabh Fadnis. I am a consultant gynecologist and gynecological oncologist based in London. I specialize in women's health. I see women with variety of problems including menstrual disorders, pelvic pain, and women with gynecological cancers. I spend a lot of time helping patients understand the various gynecological cancers, what they mean, what the treatment might be, how we investigate it, and whilst our focus is not to panic, but to try and understand how we move forwards along the treatment pathway. If the word ovarian cancer scares you, listen to this before you panic. Every woman needs to watch this. The way I start explaining patients is that reproductive organs in women are deep down in the pelvis. They consist of the uterus and cervix, which is the central part of the reproductive organ connected to the vagina. At the top of the uterus, we have two fallopian tubes on either side, which is connected to the peritoneal or the abdominal cavity, and next to the fallopian tube are ovaries, which produce eggs almost every month during the reproductive age. Fallopian tubal cancer is a cancer that arises from the end of the fallopian tube called the fimbria, and ovarian cancer is a cancer that arises from mostly the outer surface of the ovary. In reality, it is very difficult to identify the source of the cancer cells. Either they are from the ovary or the fallopian tube. We believe from extensive research that most ovarian cancer actually starts from the lining of the fallopian tube, and therefore, as a distinct entity, fallopian tube cancer or ovarian cancer does not exist. The cancer is commonly termed as cancer of tubo-ovarian origin. Every woman needs to understand what tubo-ovarian cancer is. Sometimes the ovary and fallopian tube are so involved that they present as one organ. Let me make it easy for you to understand. The term tubo-ovarian means involvement of the ovarian tissue as well as the fallopian tube. Most epithelial ovarian cancer mimics fallopian tube or what we call peritoneal cancer. Therefore, as a disease entity, we have to look at it as one. It is sometimes very difficult to exactly know where the cancer started from, whether it's ovary or the fallopian tube, because these organs are so near to each other and closely related. I often tell patients to imagine a small kitchen fire. If the fire starts from a cabinet and spreads to the nearby shelf, by the time you reach it, both are burning. At that point, there is very little value in arguing which panel started first. At that point, what matters is understanding the extent of it and controlling the fire. Why does this matter? Because symptoms can be vague. It helps us guide the investigation, staging, and treatment planning. Patients often ask me, Doctor, does this mean it is worse? My answer is not automatically. What determines the seriousness of the condition is the stage, how far the cancer has spread, the biology of the cancer, what kind of cells are involved, the overall fitness of the patient, or whether the cancer is responsive to the treatment. So if you hear the terms tubo-ovarian mass, tubo-ovarian malignancy, or tubo-ovarian involvement, please do not assume the worst. Sometimes a tubo-ovarian mass can be benign, related to inflammation or infection, and may not be cancer. That is why proper test, imaging, and diagnosis is important, which is where I can help. Symptoms of ovarian or fallopian tube cancer can often persist and are vague. Stop and listen to these symptoms of ovarian cancer. Persistent bloating, pelvic or lower abdominal pain or pressure, feeling of fullness very quickly whilst eating, loss of appetite, increase in abdominal size, frequent urination or urgency, changes in bowel habits like constipation, unexplained tiredness, unexpected weight loss, and in some cases, weight gain due to accumulation of fluid, abnormal vaginal bleeding, especially after menopause. Now, here is the key. Any one of these symptoms by itself may be caused by many non-cancerous conditions. But I become concerned when the symptom is new, it is happening frequently, it lasts for more than a few weeks, it feels different from your normal pattern. I often say this to my patients. If your body feels like a song that you know very well, then cancer symptoms are not like a loud alarm, but more similar like a wrong note that keeps on repeating itself. One of the biggest mistakes women make is to keep saying, it is only bloating, it is nothing serious. But please remember, bloating is common, but persistent, unexplained bloating needs attention. And for my postmenopausal viewers, if your abdomen is increasing in size, appetite is changing, or if you have bleeding which is unusual, please do not wait it out. If you have no family history, it does not mean you have zero risk of ovarian or fallopian tubal cancer. Let's talk about the risk in a calm, practical way. There are some factors that increase the risk of ovarian or fallopian tubal cancer. Increasing age, especially after menopause, family history of ovarian, breast, fallopian tube or related cancers, inherited gene mutations, especially BRCA1 or BRCA2, Lynch syndrome in some families, personal history of certain cancers. In some cases, never having been pregnant may be a risk factor, but this is only a small picture. What I want to emphasize is this. If you have a family history, then please take it seriously. If you do not have family history, that does not mean you are at no risk. Many patients I see are shocked when they say, but nobody in my family had this problem. That can happen. Family history is important, but it is not the whole story. In select high-risk women, preventative surgery may be discussed when appropriate. This is where fear can become useful. Not overwhelming fear, not panic, but informed attention. I tell my patients to think of risk similar to weather forecasting. If I tell you there is a high chance of rain, it does not mean a storm is coming. I'm saying carry an umbrella, be prepared, and don't be caught off guard. If you're a woman, you need to know how we confirm ovarian or fallopian tubal cancer. This is the part that creates a lot of anxiety because when somebody uses the word mass, tumor, or suspicion, the mind immediately races to the worst case scenario. So let me walk you through how we usually evaluate this. Common steps in diagnosis include a thorough clinical history where I ask you about your menstrual history, any particular symptoms, menopause, family history, weight changes, bowel habits, appetite, and pain. Ultrasound is often the first imaging test. It looks at the ovaries, fallopian tubes, cysts, any solid areas, any fluid. MRI scan is used to characterize any ovarian cyst because cyst can be benign or malignant. A CT scan is helpful in evaluating the extent of the disease. How far has the disease spread from the ovary or the fallopian tube? Blood tests like CA125 are important. CA125 is a tumor marker. It is a protein that is secreted by certain tumors or malignancies. A high CA125 may be a sign of cancer, but it is also increased in many non-cancerous conditions and therefore is not the perfect test. Definitive diagnosis of ovarian or fallopian tube cancer is obtained when tissues are removed either by doing a biopsy or at surgery. These are then analyzed under the microscope to give us a definitive diagnosis. That full picture gives us the real diagnosis. If you're waiting for reports right now, I want to say this clearly. Waiting is emotionally exhausting, but uncertainty is not the same thing as a bad outcome. Let the process unfold step by step. In ovarian and fallopian tube cancer, timing matters. Often, earlier diagnosis means effective treatment strategies are available. There is no single treatment plan for ovary or fallopian tube cancer, and that's intentional. Treatment may include surgery. The role of surgery is to remove all the cancer that is visible to the naked eye. This may involve removing the uterus, cervix, both the ovaries and fallopian tubes, including omentum, which is a fatty apron that hangs down the large intestine, peritoneum, and often extensive surgery like bowel surgery is necessary. Chemotherapy is commonly used in ovarian cancer or fallopian tubal cancer. It may be given after surgery or in some patients before surgery to reduce the bulk of the cancer. Targeted treatment. In some women, depending on the tumor genetics and tumor biology, targeted treatment may be offered. This is usually offered after surgery and chemotherapy. Long-term follow-up. Monitoring is extremely important, and there is a recommended regimen of surveillance once the treatment is completed. Now let me address the fear I hear the most. Doctor, is this curable? My honest answer is, if the cancer is found in early stage, then treatment is very successful. Even in cases where cancer is found in advanced stage, aggressive treatment but appropriate treatment may mean lengthening one's life expectancy. We have to accept that if patients are found in advanced stage ovarian or fallopian tubal cancer, treatment can often be complex and long. What improves the outcomes? Early attention to symptoms, care by an experienced team, correct staging, completing the recommended treatment, and adhering to regular follow-up. If there is one key takeaway I want to leave you with, it is this, is that ovarian cancer and fallopian cancer, although are rare, but persistent symptoms should not be brushed aside. If this video helped you understand the topic clearly, please subscribe to more videos like this. If you want a more personalized discussion regarding your symptoms or treatment options, please book a consultation with me using the link in the bio.